Dealing with constant hip pain whenever you squat can be incredibly frustrating, and you might even be thinking that you have to just give up squatting altogether to solve your hip pain. But luckily, this probably isn't true. I've been helping lifters solve their hip pain and get back to pain-free squatting for 10 years now, and I'm going to share with you 4 of my favorite strategies that you can use to do the exact same thing. One of the quickest and easiest adjustments that you can make to your squat training to make it more comfortable and solve your hip pain is just to simply adjust your squat stance. You may have been taught that you have to squat with a very specific stance, such as feet hip width apart and toes pointed straight ahead, but that might not be the best way to squat for your hip anatomy. We each have unique things about our hip anatomy, such as the angle of our hip joints, the size of the socket of the hip joint, and the angle of the neck of our femur. This means that no two people's hips are built exactly alike, and no one squat stance is the best for everybody. Some people's hips are built to squat with a very narrow stance and toes more forward, while other people are much better built to squat with a wider stance with more toe flare. The key to not only perform best in the squat, but also with the least amount of pain, is to find the stance that is best suited for your own hips and to train with that over time. You can do this by simply trying different squat stances and seeing which one feels best on your hips. You can also use a modified scour test to find what squat position might be best for you. All you have to do is lie on your back and hug your knee to your chest. From here, sweep your knee across your body in both directions, finding what position or angle of the hip joint allows you to feel the most comfortable in deep hip flexion. If your hip feels more comfortable when your knee is farther out to the side, this might mean that you can squat better with a wider stance. Versus if your hip feels better when your knee is closer to the inside, then you might squat better with a more narrow stance. The next strategy is to just use different squat variations that reduce the demand on the hips. Typically speaking, a narrower squat with a more upright torso position is going to place less demand on the hips than a wider squat with a more bent forward torso position. Squat variations such as high bar squats, front squats, and Zercher squats all allow you to keep a more upright torso position and might feel a lot better on your hips if you're dealing with hip pain. You can even take this a step further by using either a heel wedge or heeled weightlifting shoes that will allow you to stay even more upright with these squat variations. Use one of these more upright squat variations to train the squat over time, and as your hip starts to feel better, you can slowly progress the variation that you're using to include more and more hip demand. The next strategy is to temporarily limit the range of motion while you're squatting. For most people dealing with hip pain, the pain is going to be worse at the bottom of the squat because that is where the hip is loaded most into deep flexion. So temporarily avoiding that range of motion as you're rehabbing your hip and letting it calm down can be a great way to still train the squat, but not continue to irritate your hip. 2 squat variations that are perfect for this are box squats and pin squats. Set these up so that you're squatting to a depth that allows you to still train relatively normally, but with no more than about a 3 to 4 out of 10 pain. Then, as you've been training with this partial range of motion over time and the hip starts to feel a little bit better, you can slowly increase the depth of the squat variation until you're back to normal squat depth. The last strategy is to include some direct hip strengthening or rehab drills into your program. The movements that I most typically program for my own clients are hip abduction, adduction, internal rotation, and external rotation. For hip internal and external rotation, I often program the seated cable rotation variations, as the seated position is going to have a lot more carryover to your actual squat positioning. And the cable sack will give you really good control over the loading that you use for this exercise. However, you can also start with regular clamshells or reverse clamshells with or without a band if those are a little bit too advanced for you. I typically program these movements for 2 to 3 sets of 6 to 12 reps. For abduction and adduction, I often program Copenhagen and reverse Copenhagen raises for my own clients. You can perform these from the knee to make them easier, or you can add extra load to the top hip to make them even harder. Similar to the rotation drills, I typically program these for 2 to 3 sets of 6 to 12 reps. It should also be noted that some hip pain with squatting can be caused by something called FAI, which is femoroacetabular impingement. This is basically a condition in which there is more than normal contact between the bones of the head of the femur and the socket of the hip. This can cause joint irritation, labral injuries, and just hip pain over time. If you are dealing with FAI, oftentimes the best way to manage or treat it is by using the same strategies that we talked about in this video. However, in more severe or persistent cases, if strategies like this don't help, then more invasive procedures like injections or surgery might be necessary. So if you're dealing with hip pain, try these 4 strategies, and remember, you probably don't have to stop squatting to solve your injury. And let us know in the comments below what you would like to see a video on so that we can help you best.